Good afternoon. My name is Lou Weiner. I'm a physician medical oncologist. I direct the Georgetown Lombardi Comprehensive Cancer Center, which is one of 51 National Cancer Institute designated comprehensive cancer centers. Our vision statement for the Cancer Center includes the words local focus, global impact. So we've been thinking about this a lot. I don't know how I'm going to get under 3 minutes since it takes me that long to clear my throat. But and you didn't have to laugh when I said that. So anyway, we have a large number of activities related to global health. And as you can see here, we are really interested in exploring the intersection of cancer education, cancer research, and cancer care prevention and control needs in order to identify ways to improve health not only in the United States and in our catchment area of the DC region, but also around the world. The key challenges that we're trying to address in the global space are lack of clinical and research infrastructure that hinders the capacity to either educate and prevent cancer or to provide a relevant infrastructure for cancer care, a lack of trained scientists and clinicians in many parts of the world that becomes a rate-limiting determinant for care around the world, and a lack of evidence-based models for population-based cancer prevention, particularly when there aren't sufficient societal infrastructures in order to support that. Now, the context of the work has been that as an NCI-designated comprehensive cancer center, we depend in not insignificant part on National Cancer Institute funding and infrastructure to do our work. And since 2016, the enthusiasm of the federal government for supporting NCI global cancer efforts has declined substantially for reasons that are out of my control for sure. Nonetheless, Chris Loffredo, who is here and is actually one of the prime drivers of our global cancer efforts at Lombardi, and I are both on the NCI 2020 Annual Symposium on Global Cancer Research at the 2020 Consortium of Universities for Global Health Conference. And this is a big deal, and this has occupied an inordinate amount of time for both of us, but especially for Chris, in putting this together. So we're at the table, and that's a good thing. We have a number of activities in the area of cancer education. We participate in courses, lectures, and mentoring in global cancer disparities. And Lucille Adams-Campbell, who leads our efforts in minority health and health disparities research at Lombardi, and Chris Loffredo, Suzanne O'Neill, and Chirandeep Dash serve in our BS program in Biology of Global Health, the Master's program in Epidemiology, and the PhD in Global Infectious Diseases. So we're trying to be as engaged as we can in that area. We have a fair number of cancer research activities, and as enumerated here, Chris and Chirandeep, but especially Chris, have been really prime movers when looking at environmental risk factors for liver cancer and bladder cancers in both Egypt and Thailand. And Chris has been doing this work for, almost a quarter century now, right? Lucille has been studying cervical cancer epidemiology in West Africa. Diana Breathwaite, a relatively new recruit, focuses on lung and liver cancer screening in Guatemala. And Paula Cupertino, who's a relatively recent recruit of our consortium partner in New Jersey at Hackensack University Medical Center, studies tobacco control in Puerto Rico. We also are dipping our toe into the cancer care paradigm. This is really tricky business, primarily because training in people from overseas in United States-based hospitals requires licensure and other activities that make it devilishly difficult to provide people with the clinical training they need. And that'd be a great thing if we could figure out a way to make that work. But again, that requires discussions at a very political level, as you could imagine. But John Marshall, who's currently actually on sabbatical at Oxford, has developed this really extraordinary consortium of leading academic centers and pharmaceutical companies around the world to take a look at personalized cancer therapies, where by doing a very detailed molecular analyses of people's cancers, you can identify those rare mutations that can be treated by a particular drug that might be in development. And by breaking down the barriers between these companies, it's possible for anybody, anywhere who has a cancer with one of these rare mutations that might be targeted with a drug to receive the drug under a general all-purpose protocol. And that is a huge step forward in trying to take people and giving them opportunities whether or not they live in a very fancy part of the world. And it also allows us to do really great work in the global health therapeutic arena, and it's something we're very excited about. Thank you very much.